Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
What are the most common running injuries you see?
Most of the time, all overuse injuries. Either IT band issues, your IT band's a tight rubber band that goes from the top of the hip to the outside part of your leg, the foam rolling beforehand, and doing a lot of glute strengthening exercises can really help prevent that. The other thing is that if you're used to running the same loop or the same direction around town, same side of the road, changing up the direction that you're running will help. Roads are curved in terms of that, so one leg is always a little bit lower and your hip gets offline, and that puts a lot more stress on one side of your body and that IT band. The other thing we see a lot of is shin splints, stress fractures in your tibia, your shin bone, or in the bones of your foot. Things that you can do to avoid that are really more along the lines of looking at your overall training routine. Taking sometimes a day off in between to do either biking, non-impact exercises, or lower body strength training to give your body a rest from running can help. The other thing is not ramping up your mileage too quickly. A lot of people, like if they're new and they're doing like the Couch to 5K program, if they ramp things up too quickly, that's where you get into some of those shin splints, stress fractures, overtraining, bone injuries, where bumping up your mileage only by about 10 to 15% per week can really help. The other thing is, even if you're an experienced runner or someone training for a half or a full marathon, would be to include back off weeks, every 5, 4, 6 weeks, where you cut your overall mileage during that week by either 50%, or some of my elite runners will even just take a complete week off and cross-train, lift, bike, pool, elliptical, where there's not as much pounding to cut down on that.
Are running injuries different between men and women?
One of the areas, though, we do see more of in women is runner's knee or patellofemoral pain syndrome. It's another overuse issue, but it's almost 5 to 6 times more common in young female athletes and female runners than male runners, and that's just because women have higher estrogen levels, there's more ligament looseness, and runner's knee is the tracking of your kneecap. If you think of your kneecap as like a train and a track, it's sliding around. The other thing is, because women's hips are wider than men, their quads go in and then go straight down at the knee, so their kneecaps are always trying to track out a little bit. And that's where, again, lower body strength training, a lot of glute and inside quad muscle, we call the VMO, exercises are really important. And a lot of runners actually don't do lower body strength training because they think that they get their strength and their leg work in with the runs. But a lot of times doing that posterior chain, glute and hamstring exercises can really help in injury prevention.
Are women more prone to ACL injuries?
ACL tears in general isn't something you're going to see a lot in your recreational distance runners, because in general running tends to be a straight ahead linear activity, whereas ACL injuries are more plant, cut, twisting injuries. And again, you're going to see those in more of your field sports like lacrosse, basketball, soccer. Women are at a higher increased risk for a variety of reasons. Part of it is, like we talked about, that quad angle. Part of it is a little bit more ligament looseness. Sometimes it's, again, the quad to hamstring strength ratio. Women tend to be more quad dominant versus glute and hamstring dominant, and that can also increase a risk. So these are sort of small factors.